If you're more than 6 months post-op and still don't have full knee extension, that's a major problem. Because the longer it stays like that, the harder it is to solve it. So in this video, I'm gonna cover the 3 most common reasons and exactly what to do about each one. And make sure you stay for the 3rd reason because it's something that most people don't talk about and it could be the missing piece for you. Hi, my name is Josh Arwanto. I'm a physical therapist that specializes in ACL return to sport. And I've helped over 200 people get through this exact stage. So let's dive into the video. Before we get into it, there's one important thing to know. If you have a consistent pain and a hard block every time you try to get into extension, it might be worthwhile getting checked out by a professional because there could be something structural. But for the sake of this video, we're going to cover the majority of cases, which can be usually solved with the right rehab approach. Having full knee extension is 100% essential to get back to walking, running, jumping, and playing sports. Without it, you get unnecessary stiffness, pain, swelling, and your body will find a way to compensate for it. So if you're more than 6 months and still missing that extension, it's not something to push off to the side. It needs to be a priority to achieve this before you add anything else on top. So let's go into the most common reasons and how to solve them. The first reason, and the most common, is walking too early or adding too much load early on. I see this a lot. If you get off crutches before the quads learn how to engage and absorb that impact, it shows up in lack of extension and swelling, maybe pain and discomfort. Or it could simply mean adding impact too early. So impact could mean jumping and running before your knee actually learn how to handle the demands of those activities. Specifically, we're talking about what we call terminal knee extension, which is that last bit of extension. So you might need to relearn how to engage the quads properly at the end range specifically, which is the last few degrees of getting full straightening. Now there's 2 ways that I like to do this. The first one is active assisted knee extension. You can use a band or strap around your foot to assist you to get to full extension, let go of the band, and actively hold that end range by yourself for at least 10 to 30 seconds. That hold time is the most important because it allows your brain to relearn that pattern again. Similarly, you can do this on the leg extension machine. So push out with one leg as far as you can, and then use your other leg to help you to that end range, and then let go of the assistance and make your injured side hold that position for at least 10 seconds. Both of these exercises are asking your quads to hold a position that it probably hasn't in months. So it's going to feel uncomfortable, but it should not be painful. The second most common reason why full knee extension is not restored is getting back to running or jumping way too soon. Running and jumping requires your hip, knee, and ankle to be able to absorb and produce force properly. So if there are no milestones or checklists that you went through before you got back to running or jumping, that could be part of the problem why. If the muscles of your legs, especially the quads and the calves, wasn't properly tested to absorb that impact, adding that load too soon can piss off or irritate the knee. This usually shows up as pain, swelling, loss of extension. So here's the solution. Use a clear checklist before you get back to running or jumping. Here's one that I use with my clients before they get back to running. At least 70% quad muscle symmetry compared to the other side on a single leg extension machine. You can also do a 5 rep max test. So what is the most amount of weight that you can do on 5 reps on your surgical side? That number should be at least half of your body weight. You also want to include movements like single leg squats, single calf raises, single leg bridges for at least 15 reps with good control. And lastly, but most importantly, is being able to hop on one leg without pain. If you're not able to achieve the things that I just talked about, and you're back to running or jumping, that could be potentially why you haven't gotten full knee extension yet. Because it simply means your knee, your hip, and your ankles weren't ready to take on that impact. So the solution is to go back and rebuild those foundations properly. Now here's the 3rd reason, and it's the one that most people never talk about, and it's a completely different mechanism than the previous 2. And it's tibia rotation. Most people don't know this, but there's something called the screw home mechanism, which allows you to get full extension with the rotation of your shin bone and your femur, which is your thigh bone. So those 2 have to rotate relative to each other to get you that full extension. So no matter how much quad strengthening you do, to get full knee extension, we have to learn how to restore tibia rotation. Here's 2 exercises that I like to restore this. A double band TKE with rotational components. You can set up 2 bands, one around your shin and one around your thigh, working through that end range extension. Seated tibia rotation with a band. Sit with your knee bent at 90 degrees, loop a band around your foot, and rotate your shin inward and outward through a small controlled range. These 2 exercises target these joint mechanics that quad strengthening doesn't. So in conclusion, Find out which of these three is driving your specific situation. It could be one of them, it could be a combination of the three. Again, if you're missing full extension and you're more than 6 months post-op, this needs to be a priority before you add anything else on top. Otherwise, you're building on an incomplete foundation, and that's a recipe for disaster and compensations later on. There's a very good chance you can still get it back, but it needs the right approach and plan. If you want to see how getting full knee extension is part of a bigger return to sport plan, I put together a free video training that explains my process with my clients. I'll drop that link in the description, and I'll see you in the next one.